Hello and welcome to Pitt Resource Connection. I'm Mary Smith, and we have Alexis Inman here from Health Assist.
Yes, ma'am.
And for those who don't know about Health Assist, what is Health Assist first?
Health Assist is a program that helps the uninsured population receive access to specialty care, also established care with primary care providers such as Greene County Healthcare, the free clinics that we have here in Pitt County, and also specialty care.
Okay, and so is this, how would somebody be referred into your program? Is it through a doctor's or a hospital or?
They can be referred from the doctor's office or from the hospital. They can or come to our main office and fill out an application.
Okay.
The application, you just have to provide income if you have income. If you don't have income, they have to provide a letter of support and just provide proof of residency.
Okay. So you're going to talk about the medical assistance program?
Yes, medication assistance
Medication.
program. Yes,
I can't
ma'am.
read. Medication, that's costly, isn't it?
Yes, ma'am. Yes, ma'am.
And so how do you all help?
Through the medication assistance program, I can help the uninsured and the underinsured receive free or low cost medication through our program.
Free?
Yes, sir. Yes, ma'am. Free or uninsured or
Reduced price.
reduced price
Yeah.
based off if they have insurance or if they don't have insurance.
So there's a qualifying factor in here.
Yes, ma'am.
And so you go through and help them get qualified for some of these services?
Yes, ma'am. We'll help them fill out the paperwork. We'll get the required documentation that the companies do ask for.
Is these the pharmaceutical companies?
Yes, ma'am. Yes, ma'am. They'll go through, most of the time you have to provide proof of income. If you don't have income, there's a form that you fill out, just letting them know that I don't have income, someone else is helping me financially at the moment. And then from there, whatever other documentation that they require, and sometimes we'll have to get the doctor's office to sign the forms for us also.
Yeah, that they're prescribing this type
Yes,
of
ma'am.
medication.
Yes, ma'am.
And so these medications are coming from the pharmaceutical companies directly, right?
Yes, ma'am. Coming from the pharmaceutical companies, and then we also have a partnership with NC Medicine, and they send out a wide variety of generic medications to our patients also,
Okay.
and some brand names.
So how do they receive their medications?
Most of the medications will be shipped directly to the patient's homes. Most of the pharmaceutical companies send out 90 days at a time. But for medications such as insulin, that has to be shipped directly to the doctor's office or to one of the free clinics that we have a partnership with.
That's interesting. I wonder why that is.
Because insulin has to be kept in the refrigerator, and then they also want to make sure insulin's very expensive, so they want to make sure that this medication is being signed off by somebody, and usually someone's there at the free clinics to sign off on the medication, and then everyone's
cold.
always there. Yes, ma'am.
It's not sitting at your door.
Yes, ma'am.
Somebody coming by and taking it. Yeah. So the providers, healthcare providers, can help their patients by linking them up with these programs?
Yes, ma'am. They can send them directly to our office. They can hand out our brochures. They can hand out our cards. They can also contact our main office, and me or one of our case managers will be happy to help them.
Is there something that the community can do to help with you all, get people involved?
Yes, ma'am. They can, again, pass out our brochures or pass out our cards. They can send them directly to our main office. And from there, we can sit down with the patient and figure out exactly what they need, or sit down and figure out a list of their medications to see which medications there is in a program for that they can get assisted with. And if there's not a program, we can kind of work with the doctor's office to figure out what else is there that we can do to try to get them, the medication that they need.
Okay. How many people do you find in our community? Do you know? I know that's. I wasn't going to sucker punch you, but I'm just wondering, how often is this happening in Pitt County? I mean, do we have a lot of people that need assistance?
We do. We really, really do. Right now, I have about 400 people on my active caseload right now that I'm helping get free medication, or either they're going through one of the other programs where they charge less than you would receive at a traditional pharmacy, and so they come, they'll come from all over. I can help anybody in North Carolina. So I have a lot of patients from over that's just like, I lost my insurance and I can't afford to pay for this medication, or I just can't afford to get health insurance and I need assistance.
Right. Okay, so they just have to show that their proof of income, what they have.
Yes, ma'am.
Okay.
Yes, ma'am.
And they don't have to be from Pitt County.
No, ma'am, they do not. For our Health Assist program, they have to either be in Beaufort, Pitt, Greene, or Martin County. But for the Medication Assistance Program, I can help anybody in North Carolina.
Wow, that's quite. Do you travel?
I can.
Okay, so the Health Assist program as a whole, this is just one program under Health Assist.
Yes,
right?
ma'am.
What other things does Health Assist do?
We are also able to help patients find primary care, and we can also help assist them to go see a specialist. We have podiatry, we have optometry, and we also have dermatology and dental.
Okay. That's quite an array of services. What is your background?
I'm a certified pharmacy technician.
Mm-hmm.
Yes, ma'am.
So you're in the right place, aren't you?
Yes, ma'am.
You know your medicines, right?
Yes, ma'am.
Okay, so this helps people get the care that they need, because a lot of people don't take medication because it costs so much.
Yes, ma'am.
What specialty care can the patients get from the Health Assist?
We can link them up to see optometry if they need it.
Okay, so
or
these are the
dental.
doctors.
Yes, ma'am.
Okay.
Yes, ma'am.
And when you link them up, is this at a reduced cost or free?
Yes, ma'am. It's either at a reduced cost where the patient may only have to pay $30, or it will sometimes free.
Okay, so now if somebody's listening out here and they say, I would like to get involved, I'm supposed to be taking this medication, but I couldn't afford it. The first step for them to do is to do what?
The first step is they can reach out to me. We can sit and have a conversation. We need to make sure that they have established primary care first before we can get the free medications, because we will need prescriptions from the doctors, or the doctor will have to complete the program application form that we'll have to send in. If they don't have established primary care, we can link them up with one of our case managers, and they'll try to get them into Greene County Healthcare or Agape Community Health Center, or either if they can't go to one of those, then we can help link them with one of the free clinics.
Free clinics.
Yes, ma'am.
But a doctor will have to sign off on the forms.
Yes, ma'am.
Okay.
Yes, ma'am.
But you can help them get all that taken care of.
Yes, ma'am.
All right, so they just give you a call, set up an appointment to come in?
Yes, ma'am.
What do they need to bring with them?
If they have income, if they can bring proof of income, they can bring proof of residency. It could be a phone bill, light bill, hospital bill, just proving that they're living at that residence, that the income or the medication will be shipped to.
Right.
And everything else, I'll provide all the other forms that they'll need.
What happens if they move?
We'll just have to show proof of residency, and I know sometimes we can't just, base it off of, okay, I'm going to move such and such date. Some of our patients, they move and they don't know that they're, moving. So we have to try to get some type of bill or something that's at that address sent to us so that we can send it to the companies to let them know that they've moved. This is now where the medication needs to be shipped to.
Okay. So that's not a problem if they move in the middle of all this?
No, ma'am.
Okay. All right. Well, thank you, Alexis, for coming in, because I know it's a tough road to hoe.
Yes.
if you need medication, and it gets very, very, very costly.
Yes, ma'am.
I hear about it all the time, and so it's great that you have this program and that you're making it available to people through the pharmaceutical companies.
Yes, ma'am.
And it takes some of the maze out of the loop, right?
It does. Yes, ma'am.
Okay. Thank you.
So thank you. Thank you for having me.
All righty. And thank you for watching the Pitt Resource Connection.